Medicine doesn't just train your hands, it quietly trains your patience, humility, and the character. Hello everyone, it's me Dr. Swarnim Adhikari, intern doctor at Tribhuvan University Teaching Hospital, back after a 1 week with the 48th episode of Internship Diaries, where I share life as a medical intern and the lessons it leaves behind. And this past week, I was posted in the internal medicine, respiratory medicine, the pulmonology, and every morning started with the PG conference at 9 a.m., listening to the resident presenting the cases, seeing professor question, correct, and guide them, reminded me how medicine is a lifelong learning process. And after that, straight to the respiratory ward, where the theory met reality. And after 2 weeks in the dermatology and psychiatry, returning to the core medicine felt intense. I immersed myself fully. I did procedures, venipunctures, ABGs, dressing, assisted in the pleurocentesis, chest tube and fictal removal, OPD works and night duties. I also failed many times, but procedure didn't go as planned. Some moment tested my confidence, but this week taught me something important. The failure is not the weakness, it's the part of being competent. Instead of constantly complaining about the system, the workload, or the people, I consciously tried to reframe my mindset. I focused on doing the task in front of me with the sincerity. Sometimes the growth demands that we put our ego aside and just do the work even when it feels repetitive or unfair. Yes, I often wish that interns were involved in clinical decision making, not just about the manual ward work. But when you can't change the system immediately, the real wisdom is finding the meaning in the work you are given. And I answered the patient questions, counseled family, and observed how these clinical decisions are made and how system actually function on the ground. And Tuesday night duty was physically brutal. Around 15 hours of continuous ward work, fatigue was real, but strangely so was the satisfaction. Because I wasn't just observing anymore, I was the part of system, the part of patient care, and the part of process. And this week reminded me that medicine is not just about comfort, it's about showing up even when tired, imperfect, and unsure. And this journey also reminded me that every patient is someone's whole world, and every small task we do, even the unnoticed one, carries the responsibility. Medicine humbles you daily, and if you let it, it slowly makes you more human before it makes you more skilled. And as Carl Jung said, I am not just what happened to me, I am what I choose to become. And every exhausting work day quietly shapes the doctor I am becoming. See you in the next episode. Keep learning, keep enduring, and keep becoming. Thank you so much.